Healthy Living on India Life Television. Brought to you by Brookhaven Heart. You are at the heart of everything we do. Board-certified cardiologists in East Patchogue, New Hyde Park, and Hicksville, New York.
Education backgrounds as well.
Identify and treat hyperlipidemia.
So we can get them good care quickly.
What inspired me to get into medicine.
And we wanted to make sure that we raise our kids.
Tailor our therapy specifically to this population.
Welcome to Healthy Living Show on India Life Television, brought to you by Brookhaven Heart. I am Tara Shajan. This is a new show that is totally about your heart health. In the show, we will be bringing in doctors and medical experts who will talk about how to have a healthy living. Dr. Kruger, with pandemic, our service provided to the patients have changed. We have moved from office visits to telehealth. How do you explain that service change, and what are the advantages we have with the telehealth? And do you have weekend hours?
Yes, we definitely have weekend hours. We offer late hours for the working people in the community. During COVID, when it was hard to get around, we opened up telehealth. We do phone visits, we do internet-based video visits. We're still doing that even though COVID has largely passed us by. We have elderly, frail patients, sometimes patients that are not very mobile. We still offer those services so we can continue to try to render care however possible.
Let's introduce the last panel member is Dr. Wasiq Rahman. Please talk about your practice and your experience.
Thank you for having me. I went to medical school in Pakistan, and I come from a family of doctors. My parents are both doctors. There are several aunts in the family who are doctors. So from a very young age, I was exposed to medicine, and I was very interested in it, which is why I made it a career choice and finally decided to come to the US. I started my fellowship in Brooklyn, went to Brooklyn Methodist Hospital, and then I met my wife in Long Island while during fellowship, and that's where I ended up because my family lives here. I have 2 small children, and we decided that we will raise our family together over here. The main thing about living here was that I think in Long Island there are people from different cultural backgrounds, and we wanted to make sure that we raise our kids in a multicultural environment where they're exposed to family members and also to people from different cultures. I myself am fluent in Hindi, Urdu, and Pashto, which I also feel that having grown up in Pakistan, it gives me a unique perspective on the cardiovascular disease process that uniquely affects people from the subcontinent. Because as Dr. Patel had mentioned earlier, the cardiac risk factors are not similar when we compare them with the other populations. In fact, they're higher. And I feel speaking the language, connecting them with them on a personal level, I think we can relate to the cardiac disease process better.
Dr. Rahman, the next question I want to ask you is, what do you recommend as a special diet, or is there any South Asian specific diet for the cardiac patients?
That's a great question. In fact, I get this question a lot in practice because, as everyone knows, the South Asian diet is predominantly very heavy on carbs, and we've noticed that there's a big population who is either pre-diabetic, diabetic. Obesity is also a huge problem, and the 2 problems are interconnected. So it becomes very difficult sometimes to kind of educate the patient what they can eat, what they cannot eat, how to tailor their diet according to the disease process. The emphasis for diabetics and pre-diabetics is always carb management because, and weight loss, of course, because staple things like rice and roti and things like these are high in carbs, and with our diet, it's sometimes difficult. So I try to tell them that try to introduce as many vegetables, as many other healthy alternatives that they can, and cut back on carbohydrates to help weight loss, help diabetes and their cardiovascular problems. Salt also is a very important part of the South Asian diet, and that's usually also a key to cut back and to help with their blood pressure, heart failure symptoms, and other diseases.
Dr. Patel, you heard from Dr. Rahman about the diet and everything. Do you would like to chip in additional some information, basically on an Indian side, because Indian nutrition is different, a little bit different from the other diets?
No, absolutely, and you know, I second everything that Dr. Rahman had said, but the question is excellent. And I think this is really probably one of the most important aspects of cardiac care, specifically for our communities, and it hits home to me because I've seen it in my own household growing up, where there is this notion of home food or home cooked food or ghar ke khana, that this is a healthy food, but this is actually a misnomer. And the reality is that most of our food, as Dr. Rahman had said, is heavily favored in terms of carbohydrates, and most of our meals consist of 60 to 70% carbohydrates, when in reality they should only consist of about 25% carbohydrates. And so we really take an emphasis in educating our patients regarding how they can change their diet to make it into more of a heart-healthy diet.
Sure. If I may add a couple of other points, in Kerala, for example, the diet is very, cooking is mostly coconut oil. We use a lot of coconut. Ghee is very popular in Kerala. All our biryanis and some of the special diets we prepare contains a lot of ghee, coconut oil. So coconut oil is not one of the healthy oils, and unfortunately it's high in saturated fat. So in addition to cutting back on the carbohydrates, emphasis should be to stick with more vegetables, fruits, vegetable oils like canola, sunflower oil. So these things, and try to, when you cook food, try to bake or grill instead of frying in oil, and try not to use oil multiple times, because it increases the trans fat content in the oil, which increase atherosclerosis, which is plaque buildup in the artery, which can contribute to heart attacks. And also, when you eat meat, try to trim away the fat portions of it, the visible fat, the yellow stuff you find on the meat. Try to trim it and try to stick with the white meat. Plenty of fish is great, especially sea fish. These are things you can do in addition.
Our viewers around the world, we need to take a short break. There is so much to talk about in our show, Healthy Living. And we have many more doctors who will be sharing the important and vital medical information about heart health, which is important to all. We'll be right back.
Healthy Living on India Life Television, brought to you by Brookhaven Heart. You are at the heart of everything we do. Board-certified cardiologists in East Patchogue, New Hyde Park, and Hicksville, New York. Call 631-654-3278 for an appointment. Same-day appointments, evening hours, short wait times, affordable self-pay fees, quality care, state-of-the-art treatments, exceptional staff, informed patients, vein clinic, cardiac pedet services, amazing and caring medical doctors to treat you well. Visit our offices located near you. Brookhaven Heart. You are at the heart of everything we do.